soon. She was also, I will admit everyone. And
All right. Yeah.
all my best wishes, Professor Shiri.
All right. Thank you very much.
Okay,
Yes.
thank you.
Thank you. شكرا جزيلا. Okay. Hello, good
Dr.
evening.
Rad was eager to start, yes.
Okay, so who will start? Dr. Radwa. Hi, Matthew. Hi, Carolus.
Hello, Dr.
Okay. Hello. So today I'm Dr. Shireen. So today we start about one of the common presentation in exam, which is cranial nerve, and examine the cerebellum. This is very common in exam. Also common in dental exam, common in the MRCS. This is simply because our MRCS exam is including ENT surgeon. Our first topic in 10 minutes, examine the cranial nerve. Is anyone ready to start? Just tell me what he will start. How to present yourself in this situation. Anyone? Okay. Anyone just tell if we have a cranial nerve examination, how he can start, because we just need to know, we show you that your mistake, what you make it wrong, so to avoid to do it in exam.
Hello, sir.
Hello. Okay. Hi, Iman. Okay. So, Iman, you have 10 minutes. I have a timer. So you need to examine cranial nerve for this patient. This patient can be normal. So it is not necessary to have a finding, but just tell me how to examine the cranial nerve. We can start?
All right. I will
Okay.
start by introducing myself and take permission from the patient and explaining the
Okay.
procedure.
Start. Suppose I am the patient. Start.
Hello, sir.
Hello.
This is Dr. Imam Malik, one of the surgical doctor working here. May I confirm your name
Yes.
and age, please?
Yes, I am Mr. Limpa, and I'm 65 years old.
Nice to meet you, Mr. Lim. Today I've been asked to examine the nerves that supply in your face and your neck, and this will include me doing some special tests. That is okay with you?
Yes, okay.
Okay. In order to do that, I need you to expose your neck up to the upper chest.
Okay, I will do.
All right. I will start with the olfactory nerve.
Okay.
I will ask the patient to close his eyes and to close the left nostril, and I will introduce him to a certain smell to identify it.
Okay, after that.
The next, the left nostril also.
After that.
I will go for optic nerve. I will
How to examine optic nerve?
Yes, I will start with visual acuity with Snellen chart.
Okay.
Then after that, I will go for pupil reflex, direct constitutional.
Okay.
Then I will go for swinging light test for the pupil.
Say again. For what?
The swinging light test.
What you mean?
You swing the light between the two eyes to see to test if they will constrict or not.
You mean that you put the light in the right eye and see constriction in other eye?
Yes, the indirect. The indirect.
Okay. All right. It is including in pupil reflex. Okay. All right. After that?
After that, I will go for visual field.
Okay, can. Okay, after that?
Then for the confrontation test.
Say again?
Confrontation.
What it mean?
We confront the patient to test the for homonopia, the temporal and the lateral side.
You mean that you test the visual field?
Yes.
After visual field, what test you say? Or it is still in visual field?
Yes. No, just I think now I'm finished with the optic nerve.
Okay, after that?
Then I will go for the oculomotor, trochlear, and abducent.
Yes, okay, good.
With the H shape.
All right. Okay. After that.
After that, I will go for the trigeminal nerve by testing the sensation, asking the patient to close his eyes, and yes,
No, just a minute. The trigeminal, how to test trigeminal?
by testing the sensation in the frontal, maxillary, and mandibular area, and doing jaw jerk reflex, and ask the patient to clench his teeth and palpate for the masseter muscle.
Okay. So you test the motor by clench the teeth and test for mastication. And
Yes.
you do a sensation for the face. Okay.
And
So
ask,
you test the sensory and the motor.
yes,
Okay.
all right. After that, I will go as a trigeminal nerve. There. Okay. After that, I will go for the facial nerve.
Okay.
I will ask the patient to raise his eyebrows and close.
Okay.
Don't let me open it.
Okay.
And blow his cheek.
Okay.
Yes. And tensioning his neck.
Okay. Tense the neck. Okay.
And I will
All
ask
right.
if any problem with the test sensation.
Taste the sensation. Okay.
Yes.
All right. After that.
I will go for the vestibulocochlear
How?
nerve. I will start by marching in spot test
Start by what?
for balance, to ask the patient to march in a spot, close his eyes and march in a spot.
Okay.
After that, I will go for testing by whisper test and Weber and Riney using the tuner fork.
How to do that?
Yes, I will tell the patient to tell me when he feels a vibration in the mastoid bone.
Okay.
And when it is stop, after it is stop, I will put it close to the ear and
Okay.
tell
What
me.
it mean? What this mean?
We test the air conduction.
Air conduction is better than bone conduction. Okay, go on.
Then I will do the Riney test by put the tuning fork in the forehead and ask the patient it is.
No, this is Weber test. Okay. After that?
After that, the Riney test.
Rini, you done first. Okay. After that, what else?
The Weber test.
Okay. After that?
Okay. After that, I will go for testing the last four cranial nerve by
How?
glossopharyngeal. Ask the patient to open his mouth and say "ah." I will be looking at the uvula.
Okay.
For the vagus nerve, I will ask the patient to turn his head and cough. And for the
And to do what? To do what?
to cough.
Okay. All right.
After
All right.
that,
After.
I will test the spinal accessory nerve by ask the patient to shrug his shoulder against resistance.
Okay.
And as the last one, the hypoglossal nerve, I will ask the patient to stick his tongue out. And I will say
Okay.
if there any deviation to any side, and also to push against my hand when putting my hand in his cheek.
Okay. All right. Finish?
Yes.
Yes, it take a time, but it take about maybe 8-9 minutes, so it's okay. All right, I just go to with you one by one.
All right.
Okay. All right. So I just show you some slides. I think you can see the screen because I don't see it. You see a physical examination, cranial nerve and cerebellum. You see that?
Yes.
Okay. So first, you start by olfactory. Actually, olfactory, you don't need to lose your time. You mentioned that you put something to patient to smell.
Yes, I should ask the patient to tell what is the smell.
What you give him to smell?
I will ask the examiner. I need something to test the smell, test the patient smell.
All right. Actually, don't give you something to ask the patient to smell. Just ask the patient if you have any problem of the smell. He say yes or no according to the scenario. But we don't give you something like coffee or any spicy or something to smell. We don't do that. Even in practice, we don't do that. So just ask the patient. Okay. So this is fair. After that, you ask about optical vision. So you look optic nerve, you're looking for visual acuity, which is correct. Pupil reflex in one eye and looking to the other eye for the other constriction. And you mentioned the field of vision, which is correct. After that, you examine the oculomotors and the motor. So we started by eye, so we start by visual vision, by pupil. You can test the movement, you can test the accommodation. We don't test the color vision, just to make each shape for eye movement. Okay?
Mm.
If you need to, okay. So after that, you test eye movement both either two eyes open or one eye after one eye. So it is not a problem. We ask you, if you ask you what is the equilibrium, of course you take a long time, so we don't have a time to ask you in 10 minutes. But what happened if the patient have oculomotor nerve injury?
Oculomotor, there will be ptosis, and
Okay,
the pupil will be dilated.
yes.
Yes, the eye will be deviated laterally and downward.
Okay, what is the nerve supply of the muscle of the eye?
It is supplied by the
All,
oculomotor,
all
trochlear,
muscle of the eye supplied by oculomotor and
except for the lateral rectus, supplied by the trochlear, and the internal lateral rectus and superior rectus.
okay, so just SO4 superior oblique is supplied by 4 and the lateral rectus supplied by 6. Okay, so you did it correct. After that, you go to trigeminal. So when you examine trigeminal, you examine the sensation and the motor, just the muscle of mastication. So it is easy. So trigeminal sensation like this by cotton, you see the picture, and the muscle of mastication by clench the teeth or temporalis muscle. After that, you examine the facial.
Yes.
Trigeminal also, this trigeminal can open the mouth. After that, you go to facial. Facial is easy. You see the branches of facial as sensory. When you go to the motor, I don't understand you. What you test in the motor. Before that, why you ask why you test the you ask to test the
There's
taste?
sensation in
Why?
the facial nerve.
You mean branches of corda tympani
Ye-
coming through facial nerve?
Yes.
Okay, but this is not okay. No problem. But you need to explain that. All right. After that, you ask the patient to elevated eyebrow, close eye, blow his teeth. Of course, you ask him to tense his neck. Why?
For platysma muscle, cervical branch of the facial nerve.
Okay, all right, but it's not important, but okay. No problem. Okay, so here I will ask you, so all muscle of the, which muscle supplied by facial nerve?
Yes. I don't think that I can archive them. There is
Of course, it is all muscle of the face and the platysma, posterior belly of the gastric, stylohyoid, and stapedius. Okay? All right. It is important when you study, you know what is the question can be asked. Okay. So how to differentiate between facial nerve upper and lower motor?
in the upper motor neuron lesion, there will be loss only in the lower half of the face.
Okay, so you mean that is a forehead wrinkling and all this. So for example, you mean that something like this in upper face, so the patient can elevate the eyebrow, can close his eye. In
But
lower motor neuron lesion, he unable to do that.
yes, but in the
Okay,
lower motor neuron lesion, they will be the whole side and
it's the
ipsilateral.
whole side. What is the common cause of the lower motor neuron lesion for facial?
Parotid tumor.
Parotid carcinomas, okay, or injury during surgery. Okay, so it is important to differentiate between upper facial, upper motor. Upper motor is not affected the forehead, not affected the eye because of the cross presentation. You mentioned this is okay. After that, you go to vestibular, and you make a lot. Okay, so vestibular or tunica, what you mentioned. It is important to know that air conduction is better than bone conduction. So what you make an exam, you just put the tunic fork in the mastoid. Tell the
Yep.
patient, say, I don't feel. After that, put in the ear so the patient have the sensation of vibration. So this is Rene test. After that, you put in the forehead, and it's any lateralization, so it is a Weber test. So just to say that, just to do that quicker, don't waste time to do it many times. And just to give him the idea, air conduction is better than bone conduction. After that, you go to, I think you ask the patient to march. I don't know why.
For balance,
Why?
for the vestibular part of the vestibular nerve.
It is vestibulocochlear or cerebellum can cause imbalance. Is vestibulocochlear can cause imbalance? It is can cause vertigo, tinnitus, but is not affected the imbalance. As much as I know.
How to differentiate? I don't quite know actually.
How to differentiate what?
How to differentiate is the problem is in the balance in the vestibulocochlear or in the cerebellum?
No, it is another station, because in exam we have two stations, one cranial nerve and one cerebellum examination. We take it after this, but it is not in this station. You don't supposed to be neurology. It is not neurology exam, so don't be so sophisticated. Okay. What else? So this is not need to ask the patient to walk. All right. After that, you go to glossopharyngeal and vagus. Just to look into the uvula. If something in uvula, what happened? If the patient have deviation laterally. Okay. Of course, no need to ask the patient to cough. It is not a logic test, by the way. Okay. After that, so don't ask that. After that, you spinal accessory, supply to muscle, trapezius and sternocleidomastoid, you make it. After that, you ask the patient to protrude his tongue. Okay? So, so all this is okay now. So I think your presentation is good, excellent. Of course, this station is critical because you know that you take about 8 minutes. So it take a time, maybe sometimes you don't have a time to ask you question. All right. Of course, you need to make it quick. You need to be trained on it because this station is difficult. I happy that you don't put yourself in the common mistake happened in exam. What is the common mistake happened in exam is that most of the student ask the patient about some called mental, many mental status. We don't do it in surgical examination. We don't do in cranial examination. So don't do that. Okay, you understand me?
Yes. The
so no need, yeah. So we don't know. I see many students ask about this. No need. Of course, we don't ask the examiner about something to smell by patient. I think you did it good. No need to ask the patient to march. Don't beat yourself in differential diagnosis, because if you do something unnecessary, so maybe the examiner asks you why you do that, and this is you lost some times, and you lost time, so you don't reach the final of 9 minutes or 10 minutes. You speak faster, you speak good, you are well prepared, but actually you take 8 minutes. Okay. This station is a nice station, very common, and we consider as one of the killing station in the exam, because most of the students all over the world have bad performance. Not bad performance, he don't reach the hypoglossus. Last question, if you reach a hypoglossus, how to test the hypoglossus there?
I will ask the patient to stick his tongue out. There will be deviation in the tongue.
What is the common operation you can in surgery? You can have hypoglossal nerve injury.
Submandibular gland.
Submandibular, if it is deep, it is difficult, but what operation in England can cause this?
Yes, the aortic, not aortic, sorry, the
carotid end arterectomy. In carotid end arterectomy and carotid body tumor, they can cause this, and they usually deviated to the site of the lesion. But if the patient have a stroke, sometimes they go to the other side. But this is examine the hypoglossal nerve. Well done. How you feel the station? Is okay or difficult, or what is your opinion?
It is difficult and it is long.
Yes, because you know that in the policy of exam, if you don't know the policy, we don't have all pass or failed. It is even if the exam is difficult, not all the student pass. If the easy, not all the student pass, not all the student fail. So this is, you know, that our exam is not a fair exam. It is somewhat like a competition exam. So just to choose someone to travel or to work in England. It is the aim of exam. So usually you have some hard stations. This is one of the hardest stations. Okay. So, but just management of time, most of the students don't reach the hypoglossal nerve, by the way. So
The longest
after
one is optic nerve. I think
say again.
yeah, the optic nerve has the longest examination.
No,
I think
no. It is just, I think it is just, of course, the visual field just to show him any circle, any snail chart. And after that, just pupil reflex, look into the second eye and field of vision. And after that, the eye movement. It's not take a time. If you used to train it in your friend or any of your colleagues, you can find it is easy. Okay. We know that, you know, this station is coming more than 10 years, maybe more, maybe 15 years, and still the student have bad performance, by the way. Okay. So no problem. Any question? Anyone have any comment? Anything to add? After that, we have the second difficult station, which examines the cerebellum.
I have a question. In
Yes.
the examination, do we need to do the fine touch and the pampering, or only one enough?
Say again, what mean by fan touch for what?
Fine touch, using a cotton wool
Yes.
for fine touch sensation. After that, we need to do a pampering sensation, or only one is enough?
No, only one is enough. I tell you, Dr. Iman,
Yes.
usually who fail in exam is the what's called excellent student. So we examine staff of the college, like staff of the university, which is top student. Usually they are candidate for failure because they have a lot of knowledge and they need to be more clever. You know that who pass the exam is the common is the student in house man or the young student because have no much knowledge and they take the simple test. So if you are more clever in exam, the possibility of failure is very high. Because not for mistake, because you do a lot of unnecessary investigation or examination and you lost your time, so you don't reach the end of the hypoglossal nerve. So don't be so clever. Don't say, I read in some books something like this, I do that, I do that, I do balance, I do walking. If you do a lot of tasks, we don't stop you, but at the end, the bell ring and you don't finish, maybe you reach the 7 or 9 cranial nerve, so it is easy to fail.
I have just
All
a
right.
small comment, Professor Shiri.
Okay, can.
Yeah, the pin break test for the skin is not allowed because candidate becomes nervous and some of them cause injury to the skin. So we don't allow pin break test even if you ask the examiner, can I do pin break test? Is not allowed. So you only use cotton wool. Secondly, we prefer you not to touch the skin of the face if you can. It was during COVID era when we have the cranial exam, it was completely forbidden. But even now, try not to touch the face of the candidate as much as you can. And we don't use tongue depressor as well. You just mentioned I will do gagging reflex, but we don't allow it because this is an actor and he has to do 20 station. So at least you show me that you're capable of doing it, but you're not allowed to do it. The last point regarding field examination. Some of the cases have homonymous hemianopia. And we tell the actor that you don't see what is lateral to you, you only see what is in front of you. So sometimes candidate, when they do test, they don't come in front of him. So he said, I don't see, but he doesn't tell him that I can see when the finger in front of him in cases of homonymous hemianopia.
By temporal hemanopia, it is of course
Bitemporal
of
hemanopia,
pituitary
yes.
adenoma. For
Yeah.
pituitary adenoma.
Yeah,
Yes.
so it's important for you. And I really, some of the candidates, I feel very bad because he done everything well, but when he was doing testing field of vision, he actually not taking the whole field. He stops maybe 10 or 20 degree in front of the patient, and the actor say, I can't see. If he continue, then he will see, and he will lose the whole station. So these are some of the tips and tricks for this station as well. Thank you,
Okay,
Professor
thank
Shireen.
you. Okay, thank you. The second station is cerebellum. How to examine cerebellum, examine the patient's cerebellum. So anyone volunteer or still Dr. Iman, up to you.
I can volunteer, Dr. Shireen.
Okay, all right, can. So examine the patient's cerebellum. Just tell me, and after that I show you the picture. So what you will do?
Okay. I just finished my exam in March, and I had the same station in my exam, which I didn't
In which center?
in Al Maadi Hospital.
In Cairo, Egypt. Yes. Okay. All right. So what you feel this station, easy or bad? Just tell me what you do, and I will tell you.
It was a little bit hard. It wasn't easy.
Because of the time, or because you don't know the station
Because
before?
of the time, there's a lot of things to do.
Okay. You know the station before?
Yes, I know the station before.
Okay. So just tell me what you do. We can't count the time now. What you will do?
Firstly, I will.
No, I am the patient. Just speak to me.
Okay.
Good morning.
Good morning. My name is Dr. Muhammad Nabhan. I'm one of the surgical doctors. Today, I have been asked to examine your.
Okay, I am Mr. Adam. I am 25 years old. Okay, go on.
Hello, sir. So I will start with the gate. Can you just please stand up with me?
Okay, gate. Okay. Comment on the gate? No comment.
Yeah.
You comment or not comment?
While he's walking.
The patient gait is normal or abnormal?
Abnormal gait.
Oh, so say abnormal gait. Okay, what else?
Then I will do the Romberg test for him.
Okay.
As I will ask him to close his eye, and I will wait a little bit to see if he's steady or not.
Okay.
Then I will start with the eye movement for nystagmus.
Eye movement for nystagmus. Okay. Okay.
Yes.
All right.
And I will ask him to say some words like British Constitution.
Say again.
I will ask him for the speech. I will ask him to say words like British Constitution.
Okay.
Then I will examine the last four nerves, the 9th, 10th, 11th, and 12th nerve.
Say again, 9, 10?
9, 10th, 11th, and 12th nerve.
Okay.
Then I will start with the down to the upper limb. I will start to feel the tone of the patient.
Okay.
The muscle tone, the coordination.
Okay.
So he can just reach my with his right hand to my finger and to like finger to finger and finger to nose.
You mean finger to finger?
Yes, finger to finger and finger to nose.
All right. Okay.
Then I will start to examine the dysthyroid kinesia.
Okay. What is this?
Yeah, when he just put his hand, the palm of his hand to his palm of the hand, then to his.
You tell the patient that, or you show the patient that, or what? Can you open the camera if you need? You tell the patient.
Yeah, I tell the I can show him. I think
you tell him or show him.
I think it's faster for me if I tell him. Can you just copy me, and I will just try to
you
show
tell him
what to do.
Yes, so you make the movement and the patient do it.
Yes.
Okay, that's good. Okay, after that?
Then I will do the pronator cuff one.
What is pronator cuff?
The pronator drift, I mean. When
what
he just he just make his hand in front of him and close his eye and I will see.
Yes.
Yes, I will see if his hand falls down or not.
What is this test? I don't understand it.
It's called, I think, the pronator drift.
Okay. Drift. Okay. What else? Finish.
And I will just make him put his hand again, and I'll see if there is any intentional tremors.
Okay.
I will just give him an object in my hand, and I will ask him to grasp that object.
All right.
I'll do the reflexes for the biceps, triceps, and the supinator.
Okay, good. Yes.
And I will do the coordination for the lower limb.
What is
Like,
by coordination? What is coordination?
Heel to shin. Heel to shin test.
Okay, good. All right.
Yeah, for the lower limbs.
All right. So finish. You take 5 minutes. Good. Doctor, you take the report why you fail or not?
No, I think England didn't reveal it for our exam or the exam before.
We don't ask. I tell you. For example, I think you failed because you do unnecessary test and you do something is not done in the practice.
Okay.
Okay. So we start one by one.
Okay.
Okay. So first, when you start, introduce yourself. You need to ask the patient name. No problem. Okay. After that, you ask about gait. You need to comment in the gait. So the gait is abnormal gait or what type of abnormal gait?
You know, I will comment it while he's gating or after I finish.
No, like he walk after what?
After I finish the examination, he
will.
No.
Actually, it is important. It is first time you enter the exam, doctor.
Yes, it's my first time.
We have a policy in exam. We don't have a presentation in the traditional way of history taking or examination. We don't have a presentation at the end because we see you. So what you need to do it. What you need to tell us at the same time. So this patient walking is abnormal gait. Like for example, he walk in his tail, into limping, whatever the gait. Usually he's actor, so whatever he make, you need to comment in the gait. You don't comment in the gait. First mark. Second, you test for 9, 10, 11, 12. Why?
I think it's connected to the cerebellum.
Are you sure?
Not sure.
Okay, so this is wrong. This is, if you make it in exam, you don't take mark and you don't take minus. It is 0. So no mark.
Okay.
First.
So it just waste my time.
Okay. Second, you test for nystagmus. Why?
I think some cerebellar tumors might cause nystagmus.
It is not cerebellar tumor. You mean cerebropontine tumor. Cerebropontine tumor is not a cerebellum. Cerebropontine angle is not in the cerebellum. So their test of the nystagmus is also not in the score sheet. I tell you what we have in the score sheet.
Yes,
so
okay.
9, 10, 11 is not in the score sheet. The nystagmus is not in the skin sheet. You ask about species. Why?
About speech?
Yeah. Or I think that.
Yes, I asked about speech.
Why?
I think some cerebellum problems might have problem with speech, so they can't,
Actually,
speech.
doctor, it is just staccato speech is not for cerebellum. Maybe basal ganglia or something like that, but it's not direct. So cerebellum is mainly for coordination. So this is also is not in the answer sheet. I just tell you what we have in answer sheet. I tell you.
Yes, I can understand, and that's honestly, I think it's shocking for me. It's shocking for me and for all candidates, I think, watching us, because we have.
No. If you are, I don't know what is your background, but if you go to any surgical book, just examine the cerebellum, the life is easy. Okay. Or if you go to any physiology book, what is the function of cerebellum is easy. I tell you at the end. After that, what is pronator drift? I don't understand what is this.
When the patient just moving his hands in front of him, and if he closes his hand and the affected side of the cerebellum, if it's right or the left side, it will just drift down.
Actually, we don't hear. You found it in book?
I found it, yes, in books.
In book, in text, like any traditional book?
No. I don't think
this
so.
is this is the first time I hear about it. I am examiner for 16 years. I attended this station more than 100 times.
Okay.
First time to see from a student. Okay. After that, reflexes. Okay. Coordinator. Why you test reflex?
I think doesn't affect cerebellum doesn't affect some reflexes.
I think so not. Okay, I just show my presentation. After that, we can speak again. All right. So you see the tongue. You see this tongue. You see my slide, or I share again.
Yes, I can see it very clearly.
Okay, so in cerebellum function, we test 1, 2, 3, 4, 5 tests in 5 minutes. Gait of the patient, comment on the gait. Romping test, which is ask the patient to stand, eye close, arm outstretched, support the patient. If fall, it is positive romping test. After that, finger nose or finger to finger test. After that, the movement of this kinesia. After that, heel to shin. 1, 2, 3, 4, 5. Okay? In detail. In detail. Cerebellum function, gait, romping test, finger nose or finger nose. This diazokinesis, heel to shin. This is the first romping test. Ask the patient to close his eye, stretch his hand or hand beside him, support him, do not fall. He fall in one side. So it is positive if he fall. Second is finger to finger with these nice actors who can do finger to finger. This is found in Jikimedics. I tell you about Jikimedics, just remind me. After that, heel to shin. Okay. After that, diazokinesis or diazokinesia. Okay. 1, 2, 3, 4. After that, thank you. This is a picture of Malaysia when we run the exam. So again,
it's very
1,
nice.
2, 3, 4, 5. 5 minutes, very easy station. You are so clever, doctor. I think you are neurosurgeon or something like that. So it is easy to fail. What are you, neurosurgeon?
No, I'm vascular surgeon.
Okay, so vascular is easy. So I first, this is picture is from Jikimedics. So back again. So this is picture is for Jikimedics. Jikimedics is official for student, for our student in England. So if you need to see something like this, you can just Google in the YouTube Jikimedics or can Google in the site of the Royal College. You can find. As you see, the test is easy. Just gait, romping sign, and finger nose. Diazokinesis, I may be pronounced wrong, and the heel to shin. Ask the patient to stay in coach and do that. So, from your point of view, if I am examining you, I think you will be in critical situation because you mentioned 1, 2, 3, 4, 5 item. You take it 0. You maybe you do it good, but it's not necessary. What is the response of the examiner, by the way? Doctor, what is the examiner response? He stop you or leave it to do that?
He left me to do. He didn't interrupt me while I was examining the patient, and when I finished, he just told me what was you doing.
Okay, I think usually I have a habit that I redirect the student, but I found the student at the end they complain from me because, for example, if you make nystagmus or cranial nerve examination in this station, so some students say he interrupt us and he interrupt our sequelae. So sometimes in some country like India, I stop to redirect the student. But most of the students do like you, by the way. Okay, you are the only one, but don't do something unnecessary. If you do something unnecessary in easy station, so you mean that, so don't be so clever. If you are so clever, it is easy to fail. If you are senior doctor, more expert, it is easy to fail. If you need to find any way of clinical examination. Just to go to GK Medics, you can find what is the United Kingdom student do. I have experience. I was examining Cairo many years ago and found one of the student, and she is girl. She smells the patient mouth in abdominal examination. And she passed the exam, but after that I asked why you do that. She said, I looking for fetal hepatica. So I tell her, you expected we have patient with liver cell failure and come to the exam to be candid or simulated patient for exam. So it is important, don't do something unnecessary until it is found in book or found in Dr. Shireen notes or Dr. Muhammad notes. Whatever may be I wrong, but if you are in the level of the Royal College of England and you have some misunderstanding, we have only one choice, which is normal browse textbook or any official site for that. Of course, I don't know why you bring all these topics. It is from text of neurology or something like that, maybe bigger.
No, it's from some doctor's notes. It's not from.
Okay, you know that it is important to know the college. Of course, we have the most of the idea of other doctors. They are either our student or our friend. But you know why the college leave this is book to be published? What is your opinion? Yes?
I don't know, honestly.
No, because we don't need the result to be 100. So this is the book is the easy way to make the result is not 100. Because they have a lot of experience, a lot of seniority, because most of these doctors Google it. So they have a lot of things. But have you see what is the station now is easy or difficult?
Yeah, it's a way easy. Like I was doing for more than 50% of it, unnecessary tests, and it wastes my time.
But actually, you do most of it, except I think you do all. But I think the examiner become angry because you lost the time, because you do gait, you do romping test, you do finger nose, you do this hand movement, heel to shin. I think you did all. But because you add 5 other items, so make him maybe in stress or he don't notice that you make the original one.
Okay.
Okay, so just take it easy. If you have any problem, go to normal browse. Don't see any other text.
Okay, I have some questions regarding to this station. Can I just ask it?
Can.
So about the comments. So if I do any of the 5 items, should I comment during doing that item? Like,
of course, because usually what we teach is a student. If I hold this area and they don't tell me what you hold, can be lymph node, can be submandibular, can be carotid.
Okay.
I don't know what you are doing. So in some situation, you need to comment, this is patient is walking, so his gait is abnormal gait. But don't say, because in other exams, especially in India, I found the student come to the back of the patient to examine his neck lymph node. He said, I go to back to the patient. I see him, he become in the back. Okay, I introduce myself to the patient. You need just to introduce. So if you don't comment, suppose you put your hand here and don't tell me I feel carotid, for example, or I feel the lymph node. So which mark I put it? I put it in the lymph node or carotid? In the thyroid, we have 2 marks, one for lymph node, one for carotid. So if you put your hand, you examine the lymph node and tell submental, submandibular, periauricular, post-auricular, you need to enumerate. So I know that you examine the lymph node. In some country, I found the student, I examine the patient gland. I tell him which gland. So it is lymph node. Okay. So it is important just to don't to become easy. Of course, you need to ask the patient about his name.
It's more remarkable, Professor Hariri.
Okay, thank you. Is any one of the students have experience in cerebellum?
Dr. Shireen, I have another question, please.
Okay, Karen.
Okay, I had like after we finished, he asked me like a hard question. I didn't.
What is this question?
The question was, what is the new type of surgeries that we do for cerebellum?
New type of surgery?
Yes.
Maybe he asked about gamma knife or something, what is called the stereostatic surgery, what's called the gamma knife, but it is not in the answer sheet.
Okay.
It is found, I think, in the usually in the Nasr Institute in Cairo.
Okay.
Matthew, what is your opinion? What else you need to add from the Asian culture?
I think when he mentioned nystagmus, staccato speech, I think those are part of the cerebellum as well, and also to test the tone muscles and also the reflexes.
Okay, I check it, but I don't found in the answer sheet, so this is why I don't ask. But okay, we can check for it, no problem. But in the checklist, I don't found it. Okay. What is the relation between cerebellum and the nystagmus? I think no. You mean something for coordination, maybe?
Yeah, because it's you get nystagmus as well when it involves the there's involvement. It was part of the geeky medicine, the OSCE examination as well.
For cerebellum?
Yes.
I check it again, but in the answer sheet in the college, I don't found it. I only found this 5, so this is why I attend this station many times. Is one of the difficult station because the student usually become in panic. Okay, but in the answer sheet we don't have it. By the way, maybe the who designs the question don't know that, because usually this question is done by general surgeon, not neurosurgeon. So it's not much expert, and usually we take it simple, more simple. Okay, I tell you, it's a comment from the college. The candidate, or the college says some candidate perform the eye movement testing for nystagmus. Okay, they noted that the student do it. By the way, yes. But we don't know why. But if the student do it, we can check. Maybe something we don't know it. And some
so
student also, yes.
Is it? You told us after communication skills we have to make a summary. So after we finish the examination, should we make a summary of what we have done, or we have just go direct to the
communication skill is different.
Okay.
You know, a communication skill is like you will make order in KFC, Kentucky Fried Chicken. So before he say thank you, we summarize the order. This is true. So what we do in the history taken or communication skills. But in a clinical examination is a clinical examination. You don't tell the patient in real life, summarize the case.
Okay, or even present the case. So
we don't presented the case in the regulation of the Royal College or the England. We don't present the case. The examiner observe you. Even Matthew, you are in your exam in SIB 9. You present at the end, or the examiner watch you.
Generally, I'll comment during the examination, but at the end, I will summarize the positive findings and also the relevant negative findings to support the diagnosis.
Okay, you can do that. You can summarize at the end, but don't present the whole, because simply you forget to what happened.
Okay.
Okay. Yeah. Usually the examiner is observe you. Even he's not observe you. He asks after you leave the room. He asks the actor what happened. He say he forget to do that. He forget to do that.
Okay.
Okay.
Sometime, Professor Hariri, sometime with abdominal examination, they tell you examine the patient for 6 minutes, and after the bell ring, summarize your positive findings. Sometimes this happen in the new station.
Okay, can be done in the station.
Yeah.
Yes, can.
And what I advise candidate to do is to say what he is doing while he is doing it. So, for example, inspection to abdomen, if you just look at the abdomen but don't say anything, you don't score point. But if you look to the abdomen and say no scar, no apparent deformity, no ascites, then you are scoring points. But some candidates will say the examiner, do you like me to speak as I go along with the exam or just summarize at the end? We usually say you can speak. We usually, as an examiner. And I think this is advice for candidate. If you are trained well, give me the information as you go along. Otherwise, as Professor Shirin Hariri, if you put your hand on carotid or gland or lymph node or submandibular, how I, as an examiner, assess you? But you tell me what is going on into your mind, I think is a safe scenario. Thank you, Professor Shirin.
Okay, thank you. So again, it is important when you examine, especially in the neck, you tell what you examine. Examine the lymph node, examine the thyroid, examine the carotid, because we have a lot of structure in this area. So it is just to avoid misunderstanding between you and the examiner. Okay, and of course, if you ask the patient like in cerebellum as a gate, so you can comment on the gate. You must comment. If you don't comment, so it means that you don't notice. I don't know you notice it or not. Okay.
Yes,
All
okay,
right.
that's good.
Any question? Anyone have the cerebellum station again, or anyone enter the exam have cerebellum? We still have 10 minutes, so anyone have bad experience in exam, just tell us so we can evaluate.
Professor Sharon, I have a question.
Can.
Do we do tandem gait in cerebellar examination?
Do what?
Tandem gait.
What you mean?
To ask the patient to walk with a foot in front of another, like he's walking in a line.
No need, of course. No need. Don't be. It
Just
is run in
regular-
the police station, but it is. I think it's no need to do that. If you need to do it, no problem. Okay, just don't waste some time in something funny, but it can, no problem. Usually, our checklist is easy because this is exam of general surgery for general surgeon. So we don't, even the question and the examiner is not neurology, so it's not much experience as you expected. Just in simple way. Any question? You enter the exam before Dr. Iman?
No, my exam in the next month.
Okay, all right. In which country?
In Abu Dhabi.
Abu Dhabi. Okay, all right. So it is England.
Yes.
All right. Okay. Anyone have experience in exam enter have cerebellum cranial nerve before?
Yes, doctor, I have the experience. I was in the same day of Dr. Muhammad Nabhan, but
Yes.
I passed the clinical part, but I fail in knowledge part.
Okay.
Although I did very well in knowledge, and I did very bad in clinics, but I passed the clinical, but I fail in the knowledge.
You know why?
I don't know.
Because we don't have, in this exam, we don't have pass mark, we have pass rate. You understand? Like it is in comparison to other students. Suppose I have a question. When we put this cranial examination many years ago for first time, all the students fail it. But we have a pass mark. This is out of 20. At this time, the pass mark becomes 7. So this is why you pass in the station when you are doing bad. You understand me?
Yes.
Because the other students do it bad. So the curve is within the curve, because we have something called Angoff standard setting. In each question, each station, we make a curve, 100 students. So the student between 15 and 17. So the pass mark is 15 or 14. The student, all performance, they take from 7 to 9. So the pass mark will become 9. So you can you can pass the station, also you have bad performance, and you can fail in the station, although you have good performance. Okay, so you fail in theory. You fail in theory.
That
You
is
mean, not
why
in
there is a common feeling, Professor Hariri. If you go to the exam in Egypt, your chance
Yeah.
to pass is better than if you go to exam in London, because you're London, you're competing with British graduate who will have this curve very high. And I think I agree with this point. If you coming to an exam with, let us say, more Egyptian colleague, your chances to pass is higher than if you go to England. What do you think, Professor Shireen?
Okay, no problem. He can't go to any place, but you know that your theory part, you did it good.
Yes, I
Okay.
did. I did well in theory part, but I don't.
What is your mark? For example, you have the mark with you or not?
Yes, I have.
You can-
with me. It
You
was
can send it to us in WhatsApp, for example, if you don't have it now. It is what?
one second.
Okay, so whatever, you can send it to me, but the idea is whatever your performance, it is in comparison to other performances. So sometimes you have very, very bad. I see in one station, one exam, one of the students, she is a girl and she is young and she's crying at the middle of exam, but at the end she passed.
Yeah.
Okay,
I
because
also,
it is.
yeah, I would like just to mention thing. I have prepared a checklist for clinical examination. So, for example, in the abdomen, you need to do 15 steps, and this is a checklist. And this is the steps that you are required to do because there are things that you can do, but you don't score marks. Same with cranial, same with cerebellum. And I hope with the next session, we can share the checklist and we share with Professor Shireen Hariri. And if you train yourself on this checklist, you can do it blindfolded and make things so much easier for you. Because a lot of time candidate stops, doesn't know what to do next because he doesn't have a checklist routine.
So what you need in the next station, anyone, is what topics you need to in the next station you found difficult. Anyone have an idea?
Do you mean in examination or any?
Anyone, examination, history taking, communication skills, up to you. What you need for next station.
If we can just cover, one station from every part, so we can know. As today we had the examination, and I think it's shocking for all of us, as a lot of things that we have done, I think we have done it the wrong way.
A spine examination.
Okay.
Dr. Iman advised to have a spine
Okay.
examination next time.
Spine don't take a time, so can make a spine and, for example, some neck or something like that. Okay. So don't worry. What is your performance is not mean that if you make a good performance, you don't mean you pass the exam. If you make bad performance, you don't mean that you fail the exam. Pass rate, and usually in the college we say when your day come, you will pass. So the pass is depend on the curve, and this is curve is different from question to question. And sometimes we suppose this is easy station and found the student fail, all the student fail in it. So of course we must have a pass mark, so the pass mark become low. This is a standard setting, is a common for college, but not in Middle East. In the Far East, Southeast Asia, they use this standard setting for East station. So we don't have a pass mark like in Egyptian college. You say 60%, after 60 you pass, below 60 you fail. We don't have that in the real college. Sometimes the pass mark become 70. I see one time in the pediatric, the pass mark is 45%, which is very, very low. Okay, so it is like when Allah wish you to pass, you will pass. So it is depend on the not your performance, is depend on the what happened in the station.
Yeah, but
Okay.
performance is definitely definitely an advantage, Professor Shinhari. I don't want them to think that just it's a toss of coin to pass or not. No, if you study hard, if you study well,
Yes.
you take all the advice of Professor Shin Hariri, you will pass, whatever the curve will say. So I want to confirm this. Study hard is the
The
key.
problem is it, especially doctor from Egypt or Middle East, they have the main source and have the same mistake and the same way of presentation. Okay, so this is why I think all will be the same. This is very strange, by the way, but is